We actually have a couple of new things this week, which, hasn't happened in a little while. First one, this is not a COVID update. This is just a legal update. And I'm sure you've all heard this, but I feel like I can't go through a legal update without mentioning the recent Supreme Court nominations. So as you all know, last week, President Biden nominated Judge Ketanji Brown Jackson to fill the vacancy that will be left by Justice Stephen Breyer when he gets ready to leave. For those of you who haven't had an opportunity to read too much about Judge Jackson yet, she is currently sitting on the United States Court of Appeals for the District of Columbia Circuit, a very prestigious court in the US. She's a double Harvard undergrad, Harvard Law School. She is the first African-American woman nominated to the court, and would be just the third African-American justice to sit on the court. So kind of a historical nomination. I thought it bared mentioning. But the other sort of interesting thing that you guys have all heard about in the last week or so is that the CDC is changing its mask guidance once again. Now, the last couple of times they did this, it created a lot of confusion. And I don't know that they necessarily did any service to anyone. But this is where we stand right now. The first one is that they're changing the way that they determine which areas of the country are high, medium, areas of transmission. So before it was simply based on case numbers. And I think the CDC realized that was not a very effective way to determine where your highest and lowest risk places are, because it wasn't taking into account your hospitalizations and your hospital capacity. And there is a tracker or a function on the CDC website so you can check your county to see where you fall in all of this. So I look, for example, Montgomery County, Pennsylvania, which is where I live and where I work, and we fall in the medium category. So that is helpful if you want to look at, if you have facilities that maybe are not immediately in this area, you can search the entire country, and that might help guide you on what you're going to do next around masking. But under the updated guidance, only those living in high areas of community transmission are encouraged to wear a mask indoors in public, regardless of vaccination status. That's about, right now, 37% of US counties. In areas designated at medium, that's about 40% of US counties. CDC recommends, if you're high risk, if you're immunocompromised, talk to your healthcare provider, make an individualized decision, but everyone else is no longer advised to wear a mask. And then in the areas in the country designated as low, that's about 23% of counties, the CDC leaves a decision of whether or not to wear a mask up to each individual person based on their preference and level of risk. So this may affect what you want to do in the workplace to the extent you're still wearing masks in the workplace. I know we have a lot of members who are. Some of you have dropped them, but I know a lot of members still are masking in the workplace. Can guarantee, if you haven't already, you're going to get questions from your employees. Hey, where can we stop wearing these masks? It's happening in the schools as well. A lot of schools, at least near me, are dropping the mask requirement or making it optional. I have a high school freshman. Masks became optional in his school as of yesterday. So I asked him at the end of the day yesterday, what percentage of people were wearing masks? And he said he thought it was about 60%. So you're going to see that people they're going to see their kids are no longer wearing masks, are no longer required to wear masks. And you're going to see that some people are going to want to push for not wearing masks. You might also see it from the other side though, too. You might have some employees who are immunocompromised, who have underlying health conditions, who are going to say, hey, wait a minute. Everybody wearing masks protects me, and I want people to still wear masks. So this is, one of the great challenges of where we are right now with the pandemic is there's not a lot of have-tos anymore, and you get to make your own individualized decisions. So I've recommended for a while that you have a safety plan. 2 years ago, that safety plan was 5 pages long. Now the safety plan can be a few paragraphs long, but I still think it's something that you should have in writing so your employees can refer to it, so you can show your commitment to safety in writing should OSHA ever come calling. Based on the current federal and state guidelines, I think you should have the plan. You should communicate the plan to all employees. It also is helpful if you need to discipline employees. It says, hey, we have this requirement, that requirement, and you're not sticking to it. So with regard to masking, take a look at where your area, and you might have multiple facilities, take a look where your area falls. Like I said, the CDC has a tool on its website that you can use, and you can help use that for your consideration. It also may be about the density of your workforce, how much separation you do get, how highly vaccinated you are, and I'll mention that again in a minute. Consider optional masking, even if you're going to say we don't have to wear masks. I think you don't ever want to say you can't wear a mask. So I think you would want to say it's at the very least, masking is optional. You probably want to point out to your employees that it's particularly, in the beginning, we always said my mask protects you, your mask protects me. And that is true for cloth masks. That is true for some of the lower grade medical masks. But if you're talking sort of N95 or some of the higher end surgical type masks, they do provide some level of protection for the wearer as well. So you may want to point that out to employees if they're looking to protect themselves, that they should be investing in the higher grade masks, or maybe you as an employer are willing to purchase those for your employees and make them available to them. And of course, in your written safety plan, the other things you're thinking about is social distancing, vaccination. What are you doing around positive testing or potential exposure? And of course, I got to mention vaccines. If you haven't already done it, such a good idea to know what the vaccination status of your employees is. It really helps inform so many of your other decisions. I think at this point, if you were going to issue a vaccine mandate, you probably would have done it by now. If you have issued a vaccine mandate, you probably want to include boosters in that as well. It's not clear if there's going to be a recommendation for a fourth shot or not. I know there is for some people already, but for the general population, not clear what's going to happen with that. Keep in mind, if you do want to issue a vaccine mandate, those lawsuits have gone predominantly in favor of private employers and trying to institute their vaccine mandates, but private employers have been very successful along these lines. Of course, have to allow for reasonable accommodation or disability, for disability and religious reasons, and we do have model policies in the MEA member portal if you are looking for either a voluntary or a mandatory vaccination policy. And of course, I recommend a written vaccination policy, whether it's mandatory or it's voluntary. You just want to show your employees that you're committed, that that you as an employer believe that the vaccines are safe, obviously access. And of course, that time off to get vaccinated and to recover for some employees, for some individuals, that's the thing that's stopping them. So remove that barrier if you can afford to as an employer. The ETS, the now defunct ETS, had said 4 hours to get vaccinated, 2 days to recover from symptoms. So that's not a bad guidance to use if you're going to give that time off. And then I had mentioned a lawsuit last week. I'm going to mention another lawsuit this week. And I'm just going to keep tracking these, the ones that I think that are interesting and that might apply to you as an employer. This is a federal court in Alabama, so it doesn't have a direct applicability here, but I think if we see a court in Alabama, which is more employer-friendly state, finding this way, don't be surprised if judges up in the Mid-Atlantic, Northeast feel the same way. So we had an employee who was fired following a quarantine period for COVID-19. They had tested positive, they had severe symptoms, and they filed a lawsuit under the Americans with Disabilities Act. Now, this lawsuit is in its very early stages, but basically the lawsuit has survived a motion to dismiss, and the court said, the worker adequately set forth an ADA claim, at least for now. We'll see what happens as they do discovery, as they get more information. But keep in mind, the EEOC has said some COVID cases might qualify as a disability. So you really want to take note as an employer, if you've got employees who are testing positive, who need time off, it may very well be that it's a reasonable accommodation to give them time off. And certainly if they take time off, if they quarantine, if they isolate, you want to make sure that if you are going to then take adverse action against them, lay them off, fire them for discipline reasons, recognize that that could be a retaliation claim in the making. So talk to an employment lawyer. Obviously for members, we have member legal services for you to talk to talk that through. And just, any of you have ever talked to me know I will never tell you what to do, but I will talk to you about the risk. And so you just want to be assessing your risk before you make those decisions. So I'll keep highlighting the lawsuits as I see them because I think it is interesting and it helps you understand. And keep in mind, if you are going to attend the law conference in May, Deborah Lawrence from the EEOC, I'm sure will have some examples for us of what the EEOC is really looking at strongly with regard to these cases. And then one other thing I thought that was kind of interesting, there's a lot of debate. Are we going back to the office? Are we staying hybrid? Are we staying remote? What are we going to do? But I saw what Google is doing. So Employees at Google have the option to return to the office. Currently, about a third of them are going. They've removed the mask mandate everywhere except Santa Clara County. I assume that that's because of what the county is doing. Vaccines are required for those who are working in person, but they had been doing weekly testing and they've dropped that. But what's interesting is they're putting back in place all their perks. And you remember, you used to hear years ago about how the tech companies were really good with the perks. And so Google's putting them back in place, the massages, the shuttles, the cafes, the gyms. And I think they're hoping that by doing that, they're going to entice people to come back to the office. I think a lot of companies don't want to say you have to come back because they're worried that they'll lose people. But if they can entice you to come back, because there are some people who want to be back at least a few days a week. So that's something to think about as a company. If you're not sure how to get people back, free food often works. But in all seriousness, what are the perks that you may have had pre-COVID that you've dropped that might be helpful to get people to come back into the office? So I'm going to take a look and see how many questions there are versus what might have been for Mike. Let me see. So someone asked, did the social distancing parameter change with the new CDC guidelines? Not that I've seen. Someone asked, do other members have a concern if we drop wearing, this is Chester County, do we drop wearing masks in the workplace and there's another COVID surge? Be concerned about the closing of 2 hospitals in Chester County and how they would impact treatment. I think the one thing to remember with the mask mandate and what you might do in your workplace, once you drop it, it's hard to go back, but you can do it. And I think the way if you are considering dropping it now, what you might say to your employees is, because we're in a very good place with COVID, but we don't know what might happen in the future, and we certainly reserve the right to go back and have masks in the future. All right, and let me just check and see. This is a long question here. Since the CDC guidance recommends anyone who is in proximity to someone else who is at high risk both should wear masks, should we ask our employees who need to work? Basically, I think what the question is, should we be asking people about their high risk status? The answer is no. And it's not a HIPAA issue. It's Americans with Disabilities Act issue. You cannot make medical inquiries under the Americans with Disabilities Act. If employees come to you and say, hey, I'm high risk and I want X, Y, and Z, that's one thing, but you certainly cannot go around asking your employees if they are high risk. They need to. Now, if you have an awareness, you could certainly have a conversation with someone about reasonable accommodation, but otherwise the employee should be coming to you to ask about disability type reasonable accommodation issues. And if you have a more specific question, please reach out to Jane on the hotline and she'd be happy to talk that through with you if you have a more specific scenario that you'd like to go through. And Ben made a great point in the comments, which is if you want to know what other members are doing, please go to the member, our member platform and start that conversation there. And we have number of members who are on there every day asking questions and getting answers. So please go to the member community and ask your questions there, and I'm sure you'll get some great feedback. Okay, well, thank you guys so much for joining this week. We look forward to seeing you next week. Take care.